So I've been asked to compare the short-term impeller device compared to a long-term ventricular assist device in terms of the pros and cons from a physiotherapy point of view and what the sort of ideal candidate would be for these devices. So an impeller device is normally put in just as a short-term bridge, usually to transplantation or to recovery. With the impeller device, it's possible to mobilize these patients, but it's more high risk than a long-term ventricular assist device because there's more risk of migration. We have to measure the driveline exit site before and after. It needs more people to be present for them to mobilize as well. And ideally, a long-term ventricular assist device would be easier to manage. However, having said that, a long-term ventricular assist device in end-stage heart failure is still not the preferential treatment versus a heart transplant. So we would ideally like those patients to be able to have a heart transplant or for their heart failure to improve to the point they don't need to have either the device or a transplant. However, with a long-term VAD, we are able to move the patient more freely. They are able to go home, whereas with an impeller device, they have to remain in hospital. The patient can't really be that independent, whereas with a ventricular assist device, they are trained on how to change the controllers and the batteries. They're able to be more independent, leave hospital, and I would say from a quality of life point of view, it's a better device for them. But bearing all that in mind, it would still be better if those patients had a heart transplant. So I would say that's the main difference between the two devices in terms of patient autonomy and less complications with a long-term ventricular assist device compared to an impeller.